Hey everyone, it is Tom Batman Ziegelbauer, and it's been a while since I have posted stuff on my channel. If there is anyone familiar with my content, this is definitely a departure from what I'm used to talking about. So some of you may know that back at the beginning of May, I was diagnosed with stage 1 colon cancer. And one of the scariest parts, I think, of getting that news is the unknown. And part of this video really is to help, similarly to the research and a lot of YouTube videos that I went out to find similar stories to what I had, in order to help with belaying some of that fear, hopefully for you. And if you're just watching this out of curiosity, man, this is going to be a long video. So I'm going to try to chop it up into several different sections and kind of break it out into an outline. So one is just kind of the prep part of the story of how did I get to this point. Second, we'll be going over the colonoscopy that I had. Third, we'll be going over the aftermath of the colonoscopy, because there were some definite complications. And then going into meeting with surgeons and oncologists and the pathology, getting ready for the surgery itself, and then the recovery from that, which I'm still part of, the final pathology, and then meeting with the oncologist. And then this Friday, I'm actually meeting with a surgeon. So that part we may tack on at the end, or if it's not significant, I won't. So the whole journey begins on this because of my stubbornness. I am 54 years old. I'm married. I work in IT. I drive a Batmobile. You can see the Batman behind there. I was stubborn. I don't like doctors. I'm deathly afraid of needles. You'll hear that definitely as a recurring theme throughout all of this story. And I just felt like it wasn't for me. And that was the most stupid thing that I've probably done in my life. And if there's nothing else from this video, if it can encourage one person out there to go get tested, because it's really not as big of a deal, and I'll go into why it's not a big deal. And I think people think it's a big deal because it's unknown to them. And once you have it done, then it's like, oh, well, that was nothing. So please, if you are over 45 years of age and you have not gotten a colonoscopy done yet, go get it done. Your insurance will cover for it, and you won't remember it. And it's like in and out. The procedure is literally 15 to 20 minutes. And if it's something that could save your life, I highly encourage you to do it. If not for you, do it for the ones that you love. So, gonna get off my soapbox now. So, prep. So I don't like doctors. Haven't seen a primary care physician in years because of it. And my wife had switched insurances, and one of the things that they require is doing a physical exam. So I go in, I see this new guy, which, I'm still getting to know him. I only met him in April of this year in 2024. We're now into July. So One of the final things he said, he goes, so I'm not seeing any record of having a colonoscopy done, and you're 54. You're doing one this year. And I said, yeah, it's time. And he goes, well, there's two options for it I'll give you. So the first one is Cologuard. You've all seen the commercials out there. And if you haven't, you're living under a rock. They send you a box. You poop in a box. You send back the box. And the test results come back. And my wife and I both ended up doing them like within days of each other. And mine came back with some abnormalities, which then gets sent off to your primary care physician. So I'm talking to him again, and he goes, well, now we're going to do a colonoscopy. Damn it. So it's mainly prep for it. Again, some unknown. So I did a little bit of research before it, not a whole lot. I probably should have done more, so I'll fill you in on all of the details. You're going to modify your diet in the 2 weeks beforehand. A couple days before, you're going to be on liquid, and then you're going to take a mixture of, not a mixture, but you're going to take a combination of Miralax and Dulcolax. It's going to basically clear your entire system out and give you the worst diarrhea that you've had in your life. That's not a pleasant experience. However, it makes sense because when they do a colonoscopy, which is basically a flexible tube that's going to go up inside of you with a light, a camera, and the hole, which will be able to suck stuff out of you, blow you up, so they can see what they're doing. And then they have a tool that goes the length of that, which they can lance or pull. It's like a lasso to be able to pull things out of you if they find any abnormality. So not like pleasant. However, there are some benefits to that prep. Is afterwards your appetite is going to be severely decreased. And so if you like food and you're looking for a way in order to be able to clean your system out, which I think is also important, and then be able to get to, afterwards having a lesser of an appetite, it could be a reset for your diet. Just saying. So do all that Saturday and Sunday before. I'm sorry. No, my colonoscopy was on a Friday, which is important. If you have a choice to have a colonoscopy in terms of scheduling, don't do it on a Friday at the end of the day like I did. I thought, push it to the end of the week, get it done. And you'll find out why that's probably not such a good idea. So I go in to have the procedure done. You're going to have somebody with you because the drugs that they give you is a conscious sedation. I couldn't remember that last time I tried making this video, conscious sedation. You will not remember any of it at all. You're awake, but the drugs that they give you mess with your memory. And so I'll tell you a little bit about that. So go in there, check in. Procedure takes 15, 20 minutes. The place that I went was in a hospital, and they had about 10 beds separated by little privacy screens that went around them. And they come in to put in an IV so then they can inject me with the conscious sedation medication eventionally. And I tell them the story. I am deathly afraid of needles. I don't like blood. I can't see it. I've passed out before because of phlebotomists sickened me and really messing things up. So they try to put a IV in me, and they go for my right arm, and they can't get it in that one. She's fishing in there for about a minute, and then they try my left, and they can't get it in my left, and so they go back to the right. They actually have to pull in another nurse in order to be able to do it. So finally I had the IV, and I'm like, this is not a good start. So I am not happy about that. They wheel me in to the area, which is a whole separate place. They roll me into my side, and they ask me, do I know what conscious sedation is? I tell them a little bit. I kind of understand it like this, and my memory's going to be messed up. And she goes, yeah, the type of drugs that we give you purposefully, mess with that. And then I wake up in recovery, and the GI doctor says everything went really well. We did find 2 polyps. There was one in your upper part of your colon, and then there was another one in the lower part of your colon. And tell you a little bit about each. So the polyp up top, so your colon comes up, your right hand side goes over, and then down, and then it has a little S curve, and then it goes down into your rectum. So in the upper part of the colon, and that's not where it is, you just can't see it on camera here in my abdomen. So that one was a normal polyp, where it's basically a stalk and then a little bud on it, and they go in with basically a lasso. They grab it and they pull that out. So they were able to get that all out in one go. And then they're going to send that off to pathology. The second one, and as I understand it, from your colon as it's coming across, and then it comes down, and then in the sigmoid, usually those polyps sometimes can grow around the inside of the colon. And mine was like, if you saw a log ever before in the woods, and then you had like a mushroom that was growing over it, about 30% of the inside of the colon then was covered by that polyp, which they had to take out in 3 different pieces. So he said next steps then are pathology, which should come back then on that Tuesday. You're free to go. All right. So I remember asking the nurse that was in there, like, now what can I eat? Oh, well, you can have Jell-O. You should get strawberry Jell-O, because, they say don't eat anything red or purple, I think, or red or blue, or red or purple, because it can show up as blood in your colon. That's not a good thing. So have whatever you want. And I said, oh, da 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 da. And she's just, don't go heavy. Okay, so they did a great job in terms of all the prep, up to there. Here's what to expect. And then after, there was nothing. They didn't give me a readout or a chart, or kind of discharge instructions that you would normally get in order to get back to normal foods or whatever. And so I was craving a calzone, and I thought, let's go have a calzone for dinner. So that's what I had. Don't do what I did. You'll ease yourself back. So how about some soft foods like banana, or some banana bread, like something, eggs or something. So cheese is probably not the best transition food to get back into things. So was okay that night. And then here's the next step of the saga. So we'll make a break here and a whole nother chapter. The very next day, I wake up, and my wife runs an organization here, nonprofit in Colorado, and she had an event on Saturday that you had to go to. So she said, going to this? Are you going to be okay? Yeah, should be no problem. I was still tired from the colonoscopy, and I decided to stay in bed. However, I could not get warm for the life of me. I had 2 covers on in the middle of summer, and I was so cold that I went and got a pair of wool work socks to put on, and still could not get warm. So I ended up being so cold, I started to uncontrollably shake to the point where it was almost like I was having a seizure. And I'm like, something is wrong here. So I end up going, and I go to the bathroom. One of the things with the prep, again, it's diarrhea and just very watery stool. So sorry to be descriptive. This is what happens. So I'm sitting there and I'm literally shaking to the point where I can't dial my wife's number on my phone to tell her that she needs to come home. So I try getting a hold of her. It goes straight to voicemail. And I'm thinking, I'm dying. This is one of the complications that can happen, is there can be a microfissure, and you can basically be leaking bad stuff into your system, and you can go into sepsis and you can die. Fun fact, 1/3 of people die from sepsis. So I'm a little worried that something really is wrong. So I end up calling my neighbors. They're actually at Costco picking up some stuff. My wife calls in. They say, call me back, or call us back when you're done talking to your wife. And I forget about that. Oops, because I'm like in massive pain. I talked to my wife and I said, I need you to come home now. I need to go to the ER. I can't drive myself, and I'm really, really worried. So I hang up the phone with her, and then instantly just have massive nausea, and that calzone I had the night before in the trash, because I can't I don't think to turn around and do that. Yeah, I'm just shaking. I checked to see if I have a fever, and I don't. And finally, my neighbors break in because I didn't call them back. And my wife comes in. They all arrive pretty much at the same time. I have the bathroom door shut, and I'm please don't come in. And they're like, we're just really worried. And I'm like, yeah, I'm really worried too. Let me just finish this next bout, and I'll get some clothes on and a hat and whatever, and we can go. So they rush me to the hospital. I get checked in, and I end up getting in there and tell them I had a colonoscopy the day before. I'm thinking that I'm also lactose intolerant on top of stuff. So I thought maybe the cheese, if I've cleared out my system and maybe I don't have the enzyme that breaks down lactose in your system, maybe I've flushed all those good stuff out of my system. So maybe it was that's causing all this. I just am at a loss, and I'm still uncontrollably shaking. So they take all my vitals. My heart rate is way up. They take a bunch of blood from me, and they do these things called blood cultures. So they can't just be in one of your arms. They have to take them from 2, and they have to put an IV in me, and they miss several times. just like the day before. I hate needles. Like, why is this happening to me? So, which is just kind of my luck. Like I've always had this, what can go wrong will go wrong with me. So, it takes them multiple times to try to get the IV in me. In fact, they fish around in my right arm so long that they end up having to bring in one of those ultrasound machines that you use, like when a woman is pregnant and you're looking for the baby, So they basically do that to my arm to find the vein. They can't find it, so they actually have to end up going in the left. They bring in a whole different nurse in order to be able to get that done. So I think at that time they had to do multiple blood draws plus the IV. So I think we're up to at least 4. And through my stay from 11 o'clock in the morning through 6 o'clock at night, every hour, almost on the hour, they were really concerned about one of the indications in my system, which is this lactate whole blood. So you should have a score of 2 or below is normal. At 4 and above, they are concerned that it's an indicator that something's wrong with your organs, especially your liver or kidneys. Mine was 19. Normal's 2. 4 is like kidney failure, liver failure. So they're kind of concerned, just a little bit. I'm a little concerned because I'm thinking microfissure, sepsis, third of people die from sepsis. I'm like, these are all the classic symptoms of it. Thank goodness I'm in. So they pump me full of fluids. They start dropping my lactate numbers by about 2 for every, I think they're liter bags in the IV of fluid that they're giving me. And I'm getting a little better. They gave me some anti-nausea medication, which actually helped with some of the shaking. And then we get to where my heart rate is super elevated. My blood oxygen level actually is dropping below 80, which is a big deal. And which are all symptoms again of the sepsis. And then they say, well, to double check all this stuff, we're going to do a CT scan. So CT scan is done. As they're going through all of that, they come back and they go, well, we actually don't think it's sepsis. We believe it's diverticulitis or colitis, which is basically an inflammation of your colon. And here's what we're going to do. We seem to be getting your lactate numbers back under control because you are severely dehydrated, which is one of the reasons why we weren't able to put an IV in you and all this blood and whatnot. So we've already started you on amoxicillin to help with the inflammation, because this is basically an infection that we're going to be treating you for. We're going to send you out with the anti-nausea medication and the amoxicillin. You're going to take that for 7 or 5 days, I think it was. And yeah. So 7 hours in the emergency room, and I get home. I am super uncomfortable to try and sleep on my side, which I normally do. So we have a adjustable bed. So I set it up and kind of sleeping, trying to sleep that way. Well, I didn't sleep. Plus, I just started coughing a ton because while I was in the hospital, I started developing really bad drainage and coughing a bunch. So I couldn't stop coughing for about 3 days. And the very next day, I started developing a fever. So I call back into the hospital, tell them what's going on. They said, well, we were actually going to call you because one of your blood cultures that came back shows a staph infection. Well, if you've ever heard of staph infections, those are also pretty deadly. So we're waiting for your other blood culture to come back, which we took at almost the same time. And that one's almost done maturing or whatnot. So we'll be able to tell you after that comes back. However, if your temperature keeps going up, let us know because that's a concern and we'll have to get on top of that. So it goes all the way up to 102. I'm eating popsicles and drinking fluids like mad and taking aspirin and whatnot to try to get over all of that. It gets down to about 100 and then it'll jump up to 101 and then it will decrease to like 99 and then it'll go back up to 101. So for 3 days, I had a temperature ranging anywhere from 99 all the way up to 102. And then they tell me the other blood culture didn't come back with staph infection in it. It came back with some other, I can't remember what that infection was. So they said with the staph infection, maybe it was because they didn't clean the area properly and it would have been transferred somewhere else. And I'm like, great. So you gave me staph. And this other one, so we're just going to keep an eye on you. 3 liters of fluid at least a day. And I told him, I said, I can't stop coughing. I now believe all this drainage has come and is resting in my lungs. And I tell the GI doctor this on Monday, and he finally, and this is why you don't schedule your colonoscopy on a Friday. I call in on Saturday frantic, like something is wrong, and they give you an emergency number, but they can't get a hold of them, and then they can't get a hold of me, and then I can't get a hold of them, and they can't get a hold of me. And so it wasn't until Monday that I actually talked to the GI doctor, and he's like, oh, I'm so sorry about all of this. And I told him, I said, I just don't believe in the diagnosis of this diverticulitis or colitis that they gave me off of this CT scan. And he goes, yeah, I don't either. I would have seen it in the colonoscopy because the light will shine even through the colon wall on the outside, and I would have seen that there would have been some abnormality of a diverticulitis. And that's one of the things that they do as GI doctors, is they look for that sort of stuff. So he said, it's not that. I believe there was a microfissure, and that caused you to go into the hospital, and I'm really, really sorry. We went over that there are some risks of colonoscopies, and it's 1 in several thousand cases can develop something. Even if you have a microfissure, most of the time it's fine. And I thought it was more of when they lanced out or they lassoed out the polyps that as you're passing a waste then through the colon that might have caused the infection. Little did I know that your colon is actually self-cleansing and like that. And even if you are bleeding in there, it's not actually going to pass into your bloodstream. That's kind of cool. I didn't know that until after all of this. So now they're worried that I might have pneumonia. Sepsis pneumonia, possible staph infection, and whatever this other infection was from being in the hospital. I'm like, great. Oh, and by the way, your lactate, I'm really concerned about these lactate levels that you have. We're going to send you in for some more tests. So that was Monday. I talked to him. Tuesday, the pathology is supposed to come back, and I get that. He calls me and he says, the first polyp that we took out, absolutely benign, nothing there. Second one, because we took it out in pieces, there is cancer in it, in the pieces. However, the pathologist can't tell, was it on the top of, if it was spread out kind of like those fan mushrooms are, if it was in the top of that, was it in the center of it, or was it down where they removed it from the mucosa or the inner lining of the colon? So you have cancer. That's definitely not what I was expecting or prepared for. So he said, I'm going to set you up with true referrals. I'm going to set you up with a referral for a surgeon that they should be calling you today in order to be able to schedule that up. And I was able to get in that following Monday, thank goodness. And then I'm also going to schedule or get you on the schedule with an oncologist then as well. And when they call you to schedule, you should set that up immediately as well. So I do that. I think that was like on Tuesday or Wednesday then of the following week. So I end up having to go. Then he does the orders for the lab. They send them to my primary care physician on Tuesday, late in the day. I call up to schedule to have these labs done at my primary care physician, and I'm promptly told that he is not in the office today and any outside lab work has to be approved by him. We can forward that on to another group that will do it. Are you familiar with where the hospital is in Brighton? Yeah, I was just there on Saturday. Okay. So I have to go for more tests, which means more pokes. Not happy. So I go up there and I tell them I am deathly afraid of needles. The chair that they put me in doesn't recline. I said, if you do any sort of pull me forward, I'm probably going to end up on your floor. Don't tell me about it. I don't want, if you want to distract me talking about other stuff, just get it done. And because I've had somebody pull me forward and say, oh, just hold on to this cotton gauze while I tape you up, and ended up on the floor. And she goes, oh, that sounds like something I would do. Oh, this really gives me a ton of confidence. So she, this is the blood cultures all over again. So they have to stick you in two different spots. So she tries in my right arm. She's fishing in there for about a minute. Can't find it, can't find it, can't find it, can't. Oh, I think I ran into a valve. Yeah. Brings in another gal, and she then one in my left arm, and then I think they ended up doing it in the back of my hand then to pull the other one out. So those test results come back, and I was at 6 when I left the hospital. I'm now at a 4. So I'm still at like kidney failure, liver failure. I'm drinking 3 liters of water to try and stay hydrated and try to lower these numbers down. They scheduled me up for a CT scan the following Friday because they're worried about the possible pneumonia that they've given me. And then I end up also, they want to schedule more labs. Yay. So Monday rolls around. I meet with the surgeon. Love this guy. He answers all these questions. He's drawn on a little whiteboard. Like, here's what we're going to do. So the process now is, we don't know if we got all of the cancer when they pulled out the polyp, because we don't know if they, on the underside of that, touched the colon wall or that mucosa. So what we're going to do, they tattooed the area where they took out that polyp. So we'll be able to see that. And the length of it, where the tattoo was, we're going to take 6 inches one way and 6 inches the other way. And then there's a bunch of lymph nodes that are right next to it. We're going to remove all of those. There's a vein that goes through there to feed the lymph nodes. We're going to basically cut and stop that. And then we're going to sew all that back up and then reconnect your colon back together. That should take care of everything. So if something was missed in the colonoscopy, you're young, get it done, and you'll never have to worry about it again. Because I also learned that the path of colon cancer, in terms of going from stage 1, having the cancer, and then going stage 2, stage 3, stage 4, is the migration path. So where it was is something called the sigmoid colon, which is not, so it comes up from your lower intestine up, and then over, and then down, and then sigmoid colon, and then out your rectum. So that S curve of that sigmoid, which is either Greek or Latin, means S, is the area that we're going to chop out. And so by taking that out, the next likely path of it would be to your lymph nodes, which they didn't see any tumors inside of your lymph nodes when we did the CT scan when I was in the ER. And then the other path that it would go to is then your liver, and then from there, then to your lungs. So this should take care of everything. Love the guy, answered all my questions. Fantastic. However, we're concerned that you might have pneumonia. So we're going to schedule an upper CT scan in order to make sure that there's not an issue there, because I'm not going to make an anesthesiologist really upset by scheduling you surgery and you still having an upper respiratory infection. So the amoxicillin didn't knock it out. So then I got put on another type of antibiotic. And now I go to the referral of the oncologist. So I go to the referral for the oncologist, and when I get there, it's one of the most depressing places in the world. There's probably 50 people in the lobby who are all waiting to get treatment or be seen. And I always arrive early for appointments because I'm that type of person. If you are on time, you are late. So I have all my paperwork all pre-done and I arrive 15 minutes early, and I'm the last person. Well, sorry, there was one other couple that was still left there, and it's now 40 minutes past when I was supposed to be seen. And I go up to the front and I said, "So what's going on?" And they said, "Well, here's the deal. There are 7 different doctors that we're basically shuffling the schedules around and rooms for, and we're just waiting for a room for you to be seen." So eventually I get back there. I wait in the room for a little bit with my wife. A nurse comes in. We do height, weight, She asked me about 50 questions about my past medical history. And then the oncologist finally comes in, and you could just tell that she's frazzled by the amount of people that are in this particular clinic. So it's also apparent to me that she doesn't know my case. She probably just got the chart as I was coming in and no prep work. She asked me the same 50 questions that the nurse just did and entered. And now I'm starting to get really annoyed. She goes over some of the information that the surgeon went over with me, and pretty much nothing else. And at this point, a nurse comes in and says, there's this patient, here's his chart, the test results are back. She gets up and says, so this guy doesn't have to wait. I'm going to have to leave for a little bit. I'll be back. And I turn to my wife with like laser beams following her out the door. So he doesn't have to wait, but I waited 40 minutes to get in past my appointment time. And what? What? So she comes back in, more stuff. She gets me up on the table. She starts feeling around my abdomen, blah, 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 blah. Here's what's going to happen in surgery. And do you have any other questions? No. Okay, so we're going to take a blood test. Time out. I've gotten stuck like 16 plus times already over the last week. There was nothing about a blood test. Well, we're going to do one is this CEA marker, which is a antigen for cancer in your system. And then the other one is like a genetic marker to see if this is hereditary. So, you know, your kids or whatnot. I'm like, we don't have kids. I had a vasectomy. We're not having kids. So I said, is there any way that we can push this off? And she goes, well, after your surgery, you can come back and then here's the process there in terms of follow-ups and all this other sort of stuff. And I said, time out. My primary care physician has also given me a referral and for another oncologist. And I really like to see him, as this seems to be very disorganized. You don't know my situation here, it seems like, and I don't want you to presume like we're moving forward in this relationship. She goes, okay, well, I'm going to schedule you up with a follow-up, and then for this date after your surgery, and you'll come back here and we'll follow up on what the pathology was and da 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 da. And I left there going, okay. So more laps. So I'm still high on that one result. Still at being at 4. So GI doctor reorders labs through my primary care physician. I call my primary care physician in advance to let him know that these orders have come through so he can sign off on them for them to happen. So he's like, can you come in today? Sure. Okay. So I like right now, can you come in right now to get them done? Okay. So I drop whatever I'm doing. I head up there. This is, I think, Tuesday. Yeah, Tuesday of that week. And I go in, tell the phlebotomist, hey, you're amazing. This is awesome. She did my blood work for my annual exam, and we have to do this sort of thing, and it's going to be blood cultures and blah, 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 blah. So she does the tests, and she has a question, and she's like, are you sure we're doing this one? I said, yeah. Well, that's not what it shows on this order. okay, so she does the test, does all right. And then I get the test results maybe a half an hour after I get home. And I immediately write my primary care physician a note and say, hey, this order was for lactate whole blood, and this order is for lactate. These aren't the same results or even the same metric. And here's why we're doing this again. Are we going to have to do this test again? Turns out that his lab and his clinic can't even do them. He ordered the wrong test. So we're going to have to send your stuff up to the hospital to have this done again, where they screwed up. All right. So we go, or I go up there, and I'm telling the gal, because they don't have the order, they didn't send the order up from my primary care physician. So fortunately, my GI knows that it's difficult to get to primary care physicians the lab orders and actually have them fulfilled. So he sent me a copy of that order. I then forwarded that on, or had them forwarded it on. And then like right as soon as they got it, then they got the secondary one, which then confused him because we're running two of this. Why are we running two? No, it's just one order. It's just one order. And by the way, could I not have the pink-haired phlebotomist who messed up on my last test? Here, I really don't want to have her fishing around in my arm again. Oh yeah, we'll see what we can do. And as I'm saying that, I see her like passing through the window, and you can tell that she's done with her shift. I'm like, yes, yes. So, I finally get him back, and there's only one phlebotomist on, and she's a gal definitely in her early 20s. And I get sat in the same chair, and I tell her the same story. Hey, don't pull me forward. Don't tell me. I don't need to see it. None of that stuff. I'm likely to pass out. And she goes, oh, well, why don't we just put you in a bed and have you lay completely back? Would that help? Yes, it would be amazing. And I don't know what she did in this test. It was amazing. It was absolutely amazing. I think she like did some sort of a pinch sort of thing before she actually stuck the needle in. And she said, oh, and I'm going to drop the gauge on this needle so it will actually, you won't really even feel it. And she was right. It was some of the best phlebotomy work I've ever had. So kudos to you. So that gets done. Test results come back. It's now under 2. Yay, I don't have failure of one of my major organs. So we've gotten through all of that. Now it's on to oncologist number 2. Oncologist number 2, where does he have his offices? In the hospital. I'm like, oh, I know exactly where I'm going. So go up there, waiting room, maybe has one person waiting in it. I had already filled my stuff out ahead of time, like normal, showed up 15 minutes early, got me right in. I said, this is amazing. This is 180 degrees from my last visit to another oncologist, which if you have an opportunity for a second opinion, and just even if it's more information to tie together or glue together all the information that you're receiving in this, do it. Out of pocket, it probably was an additional $300. Totally worth it, because this guy came in super confident. The nurse went through the whole height, weight, and a bunch of questions. He came in, he knew my chart inside and out before I even got there. Here's what I see. Here's what I also recommend with the surgeon. Have you seen a surgeon yet? Yeah. Did he tell you something similar? Yeah. He goes, we will need to do a CEA test here. And I said, whoa, we didn't talk about this. I wasn't prepped for having it. And he goes, we have to have this marker before you go in, so we have a level, because when you come out, if it's different in any sort of way, then we have something to have concern about. So we're doing this today. And because he was such a professional, I relented, and I'm like, okay. And she was great. She was amazing. And I told her about all the failed sticks and like, here's maybe where you should try. Did a great job. Fantastic. So we have the surgery then scheduled for the 24th then and of June here at this point. And then final part of this saga is then the CT scan that they wanted there on that Friday in order to be able to rule out that I had pneumonia. And then while they were doing that, they also wanted to check to make sure that there wasn't any cancer in my lungs, because again, that path, colon, lymph nodes, liver, lungs. So that comes back. Everything's clear. I don't have pneumonia. We can schedule that surgery scheduled. And now we move on to the whole surgery part of the story. So surgery prep for this type of surgery is very similar to the colonoscopy prep. It's basically limiting your food intake, dropping it down to liquids, and then you do basically that colonoscopy prep again in order to clear out your system. So as they're doing this resection and removing that part of the colon and everything, there's not a whole lot that's in there, if anything, to lower the risk of infection and everything. So do all that prep. They also suggest that you shower with antibacterial soap, Dial soap. And I haven't had Dial soap since I was a kid, I think. So that was like, yeah, there's a reason why people don't use this as often, but it was good. It was fine. And so did all that prep. They actually suggested drinking 2 8 ounces of apple juice in the morning before I was supposed to be there at 11 o'clock. Showed up at 11, a little before 11, had all my paperwork. We did all that. And then pre-operation prep. So they take you back into a room. They have you strip down and get into a gown. They give you these wipes, 1 per body part. So arm, chest, back, legs. It was 6. So do all that. You just don't do your face. So did all of that. And then it's time for an IV. Oh, they do blood work. They got the blood work okay, but they did 4 attempts at getting the IV in. In fact, one of them just, I think it's now healed here, but it was failed attempt. Almost a quarter of my forearm was bruised after surgery, even coming home. So 4 attempts. They had to wait for a gal to come back from lunch to actually get it in my left arm. Yeah, my left arm. And then they came back in and they said, oh, and there's this medication for anti-clotting that we're going to give you. I said, can you get that through my IV? No, we have to that has to go into your subcutaneous tissue, I think, or your fat or muscle. And so we can't put that through. And I said, can we do that when I'm out? Oh, yeah, I suppose we can do that. The anesthesiologist can do it. So they eventually rolled me off to the operating room, and I don't remember anything after being walked into the hallway. I don't remember being in the room. So that was supposed to start at 1:30 and started at 2 because they were backed up. And then I was in surgery till about 6 o'clock. They had told me before going in there that all the scripts were already pre-authorized by the doctor so they could manage my pain coming out. And then we would take a look at it again once I was back in my room. And when I came out of surgery, I was at a 9 or a 10. And they couldn't give me anything because what they said was already approved wasn't approved. So I was just climbing the walls of just horrific pain. I've been through multiple bouts of having kidney stones, and that's just been horrific experiences. And if you've never had them, I would never wish them on anybody. Been told it's like giving birth for a guy, or pretty darn close. And this was kidney stones and then some. So I really, really, really was upset. And about every breath and third second, I was swearing. Lots of F words dropped for the next 12 hours. And I know that my wife was trying to sleep in a chair by me, and I was constantly, I couldn't sleep because I was in so much pain, and we couldn't get it down below that 9, maybe down to a 8 or 7 after they had switched me off of Oxy that was being put into my IV drip. And my heart rate was high, and they were trying to get that down, pumping me full of IV fluids, and pretty much 2 days of just hell in terms of pain, unbearable pain. They're coming out. The surgery was supposed to just been done with a robot. So 5 incisions, 4 kind of going down in a diagonal across my abdomen, and another one on my right-hand side where they use a tool to go in that kind of goes back and forth, and then it has a rotating arm on it in order to be able to cut and do what they all need to do. They ran into some problems and actually ended up cutting through a major muscle, cutting that in half, and then some of my fat cells were bleeding, so they create a C-section type of incision, then lower, in order to be able to help out with the surgery. And while the uppers and the nerve block that they had for that was great, that lower incision was bad, and where they cut through the muscle was bad. It felt like anytime I moved, like I had done 100 miles bicycling or 2,000 sit-ups. It was just muscle fatigue there, and so sore. They eventually got that under control, and then had gotten to the point where they wanted to start doing some physical therapy. So they brought in a walker, 2 physical therapists showing me how to get out of bed without using any of the stomach muscles, which till you don't have use of those, you don't realize what that's all connected to. And I still don't believe that you can actually get out of bed without, even when you're pushing with your arms, you're trying to isolate stuff out or pushing with your feet. That seems to be connected up. So that was pretty painful. And they had me walk around the room with a walker that day, because one of the things before you get released, they're looking for is for you to be able to get up and transfer and things like that. So very next day, so Monday, Tuesday, that was Wednesday, getting pain a little better under control. Now they were lowering the amount of time and upping the dosage on the medications that they were giving me, and kind of staggering 2 different types of pain medications. So that seemed to help out a lot. That day I was then starting to regain some hunger. I ate some stuff later on in the day because they were concerned that I hadn't passed gas. That's another thing they were looking for. And then going number 2. And because they are concerned that as part of the surgery, your bowels basically go to sleep and they need to wake up again. So second physical therapist came in and was like, so we're going to do this without a walker today. And everything that you were taught about getting out of bed was wrong. So I'm going to teach you this other way, which is way more painful. And we're going to do it way more. So we did it a couple of times in the room. Then he got me up and down the hallway with the IV. He was holding the IV as we were going. And we made one trip around the ward. And then he said, well, how do you feel about that? And I'm like, well, it's okay. And then he said, well, what do you think about 2? And I said, I'd really rather not, but if you're suggesting it, let's do it. So 2 then turned into 3, turned into 4. I really overdid it. And then more in and out of the bed. And that strained a bunch of stuff. And I was really, really sore, which brought maybe a 3 back up to 6, 7 again in terms of pain. So we had to get that back under control again. And then I still hadn't passed gas or went number 2. I was talking to a nurse at night, and after I had some stuff to eat, like applesauce and some cream of wheat, and, I'm not trying to overdo it in terms of food versus liquid. She goes, well, I know the cafeteria's closed down, but I have some prune juice. Would you like to try that? And she brought me 2 little, they almost looked like Mott's applesauce containers of that. And within 20 minutes, bang. Went number 2, passed some gas, and then at 4 o'clock in the morning, which by the way, 4 to 6 o'clock in the morning, they wake you out of a dead sleep and they turn on the lights. So sorry, need to take your vitals. And I'm like, okay, vitals. And then she comes to take my blood. I'm like, wait, what is this? And, they're concerned about your blah, blah, blah. Okay, so 4 more times getting stuck. So I'm up then on Thursday morning and at like 4 o'clock. And then I'm starting to go like every 20 minutes, almost like clockwork. I can't stop. And meet with the surgeon. I had ordered food like right when the cafeteria opened up, because now I'm hungry. And he goes, you checked all the boxes here in terms of getting, being able to leave. So let's, you've passed gas, you went number 2, you transferred, we've got your heart rate down, and I was concerned about some kidney stuff, but you seem to be doing fine. So I'm ready to release you. So I called my wife and we went home, which was pretty painful ride. There were so many railroad tracks on the way that we ended up taking, and I was just holding on for dear life, like, oh my God. Then because of where all the surgery was done, I normally sleep on my side, and so then it's another 3 nights of no sleep. And horrible gas, like, which is to be expected with surgery. They actually want you to pass a ton of gas because not only are they filling up your colon to kind of extend it, but then they're filling up your entire abdomen, so it's got to go somewhere. And then I'm just going constantly, and I'm in recovery. The pathology then finally comes back, and they said it was going to be more than 7 days, and it actually came back 4 days after my surgery. The surgeon hadn't even received it. I called him to see if he had, and he then grabbed it and he goes, "Oh, all this looks good. It seems like we got everything here, that there's nothing listed in the pathology for either the resection, what they removed, or any tumors in the lymph nodes." And they normally only test 12, and we took 24, and they tested all of them, and there was nothing there. So things look good. And so then I just was waiting for the other shoe to drop. Something just didn't feel right. And with my past history, which you've heard of, like, it's all a comedy of errors along the way, still walking every day. And then I met with the oncologist last Tuesday and get in there, and he said surgery was a success. In fact, what it shows me is that they removed all of the cancer when they removed the polyp, when they did the colonoscopy. So he saved your life when he did the colonoscopy. And all of the rest of this was preventative, that there's no abnormalities. There's no carcinoma in the entire length of the colon that they removed. There's no tumors or abnormalities in the all of the lymph nodes that they removed. So you're good to go. So you're fired, and I don't want you to take this the wrong way, but we hope to never see you ever again. So you can get out of here. I was just in shock because throughout the whole thing, there were so many things that kind of went wrong. It's like, so we don't have to do another CEA test? And he goes, no, you were undetectable in the first one. So this shows me with these lab results that why would we run it again? So we got everything. There's no risk. You're just going to do another colonoscopy in the future, and in a year from now. And if that comes back clean, then 3 years from then, and hopefully that's it. This was an abnormality in terms of the cancer that was there. It's not hereditary. Again, finding a good oncologist who knows their stuff. In fact, this guy came up from Florida, and some of his patients still in Florida come up to Colorado to see him. This is how good this guy is. That first oncologist wanted to run a whole hereditary test, and he goes, "You mean this one? They've already run that." There's a reason that I didn't pick her. So, cancer-free, stage 0 at this point. I see my surgeon for a follow-up on Friday. Hopefully that's nothing there. I am still ungodly sore from the surgery. I'm just trying to get back to normal life. It's been a little over 3 weeks. They advise you not to lift anything more than 10 pounds, so basically a milk jug. And I've really tried to stick to that. It's really hard. Still going up and down stairs or like getting up from sitting here. I'm really curious in terms of how I'm going to be after sitting for this long at the computer recording this. But good news here in the end. So if you made it this far, we're an hour and 10 minutes in. I apologize for it being so long, and I'm going to try to break this up into sections or chapters. So if there's a specific section that's, hey, I've never gone through a colonoscopy, I can skip and only watch that part, or I have colon cancer and this is what to expect from a surgery, or like what to expect from oncologists or surgeons, and kind of tips or tricks through all of that. Hopefully there's something in here that spoke to you. And I got a lot out of watching other people's stories. Because unless you're going through it, you can talk to other people, but they don't know what is truly going on, or can share the pain or doubt or the unknown there in order to be able to help you through this process. So hopefully there's a nugget in there somewhere, something that you could take away. The other thing I really hope, if you've made it this far in the video or you skip forward to the end, is if you haven't had a colonoscopy, or you know somebody who hasn't had a colonoscopy, tell them to watch this video, because this could have been a whole lot worse than what it was. And it was just ignorance and stubbornness in terms of getting it done. I actually look forward to a year from now having another one done. It'll reset my diet and my appetite again. And I don't think that's a bad thing. And I know that my brother was so moved by hearing of my cancer, he went out and he immediately got a colonoscopy done. Fortunately, his was clean and nothing in his. And I think it's either 5 or 10 years now to follow up on his, and he won't have to worry about it again for a long, long time. And please go out and get that done, or encourage other people to get that done. It's not that big of a deal. And if, again, they need to see it, go back to that portion of the video and go through it. It's not worth the risk of not getting it done. And most of my videos are surrounded IT and operations sorts of things, and I always close them out the same way: as people don't care how much you know until they know how much you care, and I care a ton. Your guys' videos that you put out, that I was able to watch and see, that you went from the colonoscopy through the cancer and recovery and all of those other sorts of things, it's really helped me. And so I hope it helps you in some way or another. So again, appreciate all of you guys. Appreciate you taking the time to watch this, and we'll see you on the next video. Thanks.